Hello and welcome, everyone. We're just letting people in. We'll start our webinar in just a minute or so.
Sorry about that, I'm back.
Great. Well, thank you so much. I'm Jessica Collins with the Public Health Institute of Western Mass, and really very excited today to hear about gender equity in our region. Thank you all for joining us. I want to share that today's webinar is part of a series that is part of the City of Springfield's celebration of Public Health Month, obviously the month of April, led by the City of Springfield's Commissioner Helen Colton Harris. This year's theme is We Are All Public Health, and today we are highlighting gender equity. I also want to thank the Women's Fund of Western Mass, and particularly Donna Hagert, for her leadership and dedication to advancing women and gender equity in our region. So thank you all for joining us to learn about this incredibly important public health issue. Before I introduce the speakers, I do just want to go over a few things. If you have technical difficulties or need help, please send a direct chat to one of the hosts. We are recording the webinar, so the recording will be emailed to registrants and posted on our Public Health Institute of Western Mass website. There will be a brief question and answer at the end, and you can submit questions using the Q&A feature found on your Zoom menu bar. If you would like to enable automatically generated captions, click close captioning button on your Zoom webinar. And please do note that because this is automated, that they're not always completely accurate. When the webinar ends, we will ask that you please complete a short survey about the experience. It'll only take 1 or 2 minutes, and we will share that link toward the end. So now I would like to introduce Amihan Mateos, Senior Director of Community Partnerships at the Women Fund of Western Mass, as well as Lisa Rangeli, Director of Capacity Building and Assessment here at the Public Health Institute. And they are going to share their presentations with you. Thank you.
Thank you, Jessica. Hello, everybody. It's wonderful to be here with you today. And before we get officially started, what I'd like to do is just to get a sense of whether or not you have heard about the Women's Fund before. And I think it'll also be great to know where people are signing in from. So we've set up a poll to ask you those questions. And if you could just take a brief moment to do that, it'd be interesting to see what we come up with. Great. So the results are in, and it looks like most people are not familiar with the Women's Fund of Western Massachusetts. So this is the good news. You'll have the opportunity to hear more about us in a few moments. And it looks like most people are from Hampden County at 75%, and a few are from Hampshire County. Great. Thanks so much. It's also helpful for us to know about this because the Women's Fund actually focuses on the 4 counties of Western Massachusetts. So we were trying to get a sense of where you might all be viewing from. So let me just tell you a little bit about the Women's Fund. The Women's Fund was founded in 1996, and since then it's been promoting gender equity, as I mentioned, in the 4 counties of Western Mass through grant making for social impact, community partnerships, and cross-sector collaborations. leadership development, and research and advocacy. And we do all of this work with a racial equity lens so that all women, girls, and gender expansive people can get what they need to thrive and live healthy, successful, and economically prosperous lives. So as you know, the Women's Fund of Western Massachusetts has partnered with the Public Health Institute of Western Mass to conduct this gender equity study. And Lisa will be telling you more about that in a moment. But for now, I'm going to just tell you a bit about the Women's Fund. So what you see here are our strategic pillars, which are our priority areas that really guide where we focus our resources and our work. So the first strategic pillar is parity in positions of power and leadership. And it's really our goal and our hope that we will have female and gender expansive representation in all positions of power and leadership throughout Western Massachusetts. Economic security is the next pillar. And we would really love to work with communities to figure out ways to reduce poverty and to reduce the pay gap for all marginalized groups. Freedom from gender-based violence and abuse. And also we devote our resources to supporting community-based nonprofits that are working to advance the rights and address the needs of women, girls, and gender diverse people throughout Western Massachusetts. You can bring up the next slide. So these are some of our leadership development programs. One of our signature programs is our Young Women's Initiative. And it is a leadership, social justice, and economic empowerment program for young women and gender expansive young people ages 16 to 24 in Greater Springfield and in Franklin counties. And essentially, young women receive opportunities to take a look at how to step more fully into their leadership and identify, opportunities to become more clear about who they are, where their strengths are, and to really step into their roles as leaders. And one of the things that is a really powerful experience that these young women in this program are offered is the opportunity to learn about research, identify barriers that prevent young women and girls and gender diverse people like themselves from thriving. And then we help them to become philanthropists and provide them with grant money that they can actually allocate to organizations within their communities that are doing work to address these issues. So this is a really powerful opportunity for them to become change agents. The other leadership development program that we're working on that is really exciting is the Race and Gender Justice and Movement Building Institute. It's a brand new initiative, and we're partnering with the Boston Women's Fund to specifically support the leadership of women of color and gender expansive, Black, Indigenous, and people of color to become leaders within our region, community leaders, organizers, people who are coming together to build movements for social justice, impact policy, and if they would like to enter the arena of public office, we would offer them support to be able to do that. So this program is now in its development stages, and we are looking forward to launching it sometime in the fall of 2024. One of the other ways that we are really working on promoting racial and gender equity within organizations is through this program that's an equity succession planning series. And essentially what we're doing is we are helping organizations to become more equitable in the process of succession and transitions within the organizations, and really working on ways to figure out how to advance the leadership of women of color and gender expansive BIPOC so that these positions can be occupied, and there'll be opportunities for these organizations at the very top levels of leadership to represent the demographics of the communities that they are serving and supporting. So it's an ongoing monthly series. And part of what we do as well is we really take the time to learn and understand what are some of the pressing emerging issues and needs that women, and in particular women of color and gender diverse BIPOC folks are experiencing within our communities. The most vitally important thing for us to do to be able to support and provide resources is to understand what the problem is. So we partnered with the UMass Center for Research on Families because we wanted to understand what were the contributing factors to women's economic insecurity so that we could find ways to change and transform that. So some of the findings are those things that you would imagine, poverty, median income at $15,000. 83% of the participants had annual household incomes below 200% of the poverty line. And then all of these barriers that we typically think of when it comes to women who are in situations of disadvantage. So inadequate housing, lack of jobs, food insecurity, lack of transportation, and childcare, which were primary concerns. The other thing that we do is we really serve as conveners of the community. And we really bring together people to collaborate, to really talk about and understand what are the challenges they're facing and what are some of the ways that that these challenges can be addressed. And in particular, we've been focusing on making sure that we're bringing together domestic violence and sexual abuse providers from the area in quarterly convenings, just so that they can talk about, reflect on, and address some of these issues. And there have been some really important collaborations that have emerged as a result of these convenings. The other way that we support nonprofits doing the work of supporting women, girls, and gender diverse BIPOC folks and people is by bringing together women heads of nonprofits. So this is also a quarterly meeting that provides space for leaders, in particular underrepresented and marginalized women of color leaders, to share the issues that they're being confronted with, and to really be thought partners in coming up with innovative solutions and doing mutual support and learning with each other. So since we are a community foundation, one of the ways that we make our impact is by offering grants to nonprofits within the 4 counties of Western Massachusetts that serve women, girls, and gender diverse people. And since 1997, the Women's Fund has awarded over $2.5 million to more than 150 nonprofit organizations in Western Massachusetts. And just last year alone, we gave out $324,000 throughout the 4 counties of Western Mass. And I just wanted to announce that in this current grant making year of 24-25, we are in the process of accepting applications. We are receiving them until May 15th. We are really making the process of applying accessible. So people can submit a one-page letter of intent, a video, a previous grant application for our review. And we have community members that are involved in the process of making decisions around where these funds and resources should be allocated. And the awards will be announced at the end of August. And this is the link to log into in order to be able to get to our application to apply for funding for this year. Thanks, everybody. I'll turn it over to Lisa.
Thank you so much, Amihan, and welcome everybody. It's great to have you with us. And if you haven't already, please feel free to introduce yourself in the chat. We hope this will be a bit of an interactive experience for everyone. So let me go ahead and share screens. Great. So can folks see the first slide? This is the title of the report that I was very privileged to work on with my colleague Leela Ramachandran at the Public Health Institute of Western Massachusetts. She's here fully supporting me in this. We've been tag teaming with presenting these findings since last fall. One thing that I really appreciate and that Leela suggested we do is to include this quote at the outset before we even dive into the findings. And I think this quote from a female Indigenous leader, "We should be at the forefront versus an afterthought," really speaks to what the Women's Fund is trying to do and what the Public Health Institute is trying to do with this report, which is to really center folks who have been historically and continue to be marginalized in our society. And it's important as we start to dive into a lot of data to remind ourselves that we are talking about real people and their lived experience. And when it starts to become abstracted with bar charts and numbers, I just really want to bring us back to, we're talking about real people when we talk about all this information. So as I get ready to dive in, I want to just share that I also am on the board of the Women's Fund of Western Massachusetts. So this has been a great opportunity to bring those two passions of mine together around public health, health equity, racial justice, and gender justice. So I want to share a little context for the report before diving into the findings. So this report, and I'll just mention there's a full report that is very detailed and gives a lot of really important context for understanding the data that we provide, the information that we provide. And there's also an excellent summary that is much shorter and beautifully laid out by transit authority figures. And so I hope that folks will put these resources at your fingertips and use them in whatever ways you can. And we hope this report will be used. It's unique in the way that it lifts up the intersections of gender, racial, and other inequities. The fact that it does focus on all 4 counties and looks at the lingering legacy of COVID and the pandemic. As Amihan mentioned, this work is informing all the different facets of the Women's Fund's work that she just gave that great overview of. And we hope it will inform action at all levels, especially at the local and state level. We want this to be a useful resource to spur action. And so as we go through this presentation, we hope you'll think about the implications for your own work and for where you can help advocate for positive change more broadly. And I should mention that the full report contains information about policies that have been passed in the last 3 years since the last gender equity report, so that we know what has changed, what has shifted for the better in terms of policy. And then the summary report talks about ways that we can still influence policy. And there will be little red boxes that you'll see throughout the slides that speak to some of these issues where we can still be advocating. Another piece of context that's important is how inclusive this process has been. So this was the first time that the research was expanded to include transgender and gender diverse residents as subject of the research, and also engaging in conversations about how we should collect data, what kinds of data we can and should collect. We also made the decision to do deeper research about some groups that don't show up in the data or that get lost in the data through interviews and focus groups. So this included, of course, transgender and gender diverse individuals, Indigenous women and girls, formerly incarcerated women, immigrants and refugees, and survivors of domestic violence. And then we also had a very inclusive and diverse research advisory group, which helped ground us in a set of shared values, gave input, shared their knowledge, their connections for this assessment process, gave us feedback on the draft reports and so forth. If by chance anyone from that group is in this room right now, we'd love for you to just let us know in the chat. And thank you for Leela for dropping all these great resources into the chat as well. So I just also want to share data considerations, and then the broader context in which this research resides. So I want to acknowledge that data collection methods are imperfect. They're the product of humans, and humans are imperfect. The biggest takeaway for us as we did this process was just that it was very hard to find data that speaks to the experiences and inequities experienced by transgender and gender diverse residents. We still have a long way to go, whether it's public, private institutions, nonprofits, in the data that we collect about these members of our community. We try to sort of slice and dice data in different ways. However, that's not always possible. Some data can be disaggregated or sliced by in terms of race or gender, but not both. We do our best with the data that we have available, but we just want to acknowledge those limitations. And then finally, we also want to acknowledge that race is a socially constructed idea. Unfortunately, it's an idea that has had traction for many generations and that has been used to oppress some groups and advantage other groups. But just because it's a social construct doesn't mean that it doesn't have tangible impacts on people's lives. So we think it's important to acknowledge that. And then finally, the context in which this research took place. The pandemic, Roe v. Wade being overturned by the federal Supreme Court. On the positive side, we're seeing more female leadership, especially among Black, Indigenous, and women of color at all levels. There's been a national reckoning with the historical and present day ongoing racism, police brutality, the rise of white nationalist movements, even and especially in Massachusetts, and attacks on transgender rights at all levels. And so, we are lucky that we live in a progressive state relative to the rest of the country, but we know that sexism, racism, transphobia, and other forms of oppression are alive and well, and continuing to harm community members right here in Western Massachusetts. So I'm going to finally dive into the slides, the findings, and just want to say I can't possibly do justice to all the rich stories, quotes, information that's been shared. So this will be kind of a high-level run through, and we're going to experiment with making this interactive. So we have some quiz questions that we hope you'll take in the form of the poll to get your sense of what you think is going on in our region and how that compares to what we found. So the executive summary opening line is this quote. So it's a story of both positive change and ongoing injustice. And the positive change is in large part because our communities here in Western Mass are resilient. Folks are creating networks and coalitions and advocating for change, and our organization and the Women's Fund are leading many of those or supporting many of those efforts. And many other organizations, probably many of the, if not all of those of you who are on this call today, on this webinar. And yet, as we try to support each other and these systems to be better, we know that many systems and structures continue to fall short, not for lack of, in many cases, well-meaning good efforts, but lack of sufficient resources and other barriers make it so that these stories are not, they still need to be told, and the information is not always as positive as we would like it to be. And with that, I just want folks to feel that, you know, if this, some of what you hear is hard to take in, it's hard to hear, it elicits strong feelings, you know, to please take care of yourself. Step away if you need to at any point. And we know that for many folks, this is their lived experience. So, so we're grateful to convey this information, and we want to be mindful of its impact. So with that, we're going to kick off with, I think, a poll question. There we go. So which county do you think is the most racially, ethnically diverse and has the largest proportion of girls under the age of 18? All right, so we've had several votes for Hampden County and one for Franklin County. In fact, it is Hampden County. So good guesses there. So the good news is that our region is becoming more racially and ethnically diverse. We're particularly seeing a growth in Latina women and girls regionally and in Hampden County. Something really important to know as we move through this data, this information, is that close to 1 in 3 household heads are single women. So when we start to look at employment and poverty, thinking about what does it mean to have one income supporting a family. This is an aging community, an aging region, and 20% of all females in the region are 65 and over. So that has implications for women's economic security as well. We see at the state level, transgender population growing, especially trans youth. We don't have local data, but we see this trend statewide. And we also want to acknowledge that our Indigenous leaders who participated in this process said that historically and today, the census undercounts the number of Indigenous women and girls. So we want to be aware that those numbers that we provide are not necessarily reflective of what's going on in the community. So I'm going to talk a bit about employment and earnings, and then the flip side of that, which is poverty and opportunity. So we're going to have another poll question now, if it's ready. Thank you. So which county has the biggest gender pay gap? This is the amount a woman earns for every dollar a man earns. So while we're waiting, oh, there we go. Interesting. So split between Hampden and Hampshire County. So the answer is actually Berkshire County. In Berkshire County, women earn 82 cents for every man's dollar. So the good news is that the gender pay gap is narrowing over time, but we are far from at dollar for dollar parity. And unfortunately, we continue to see disparities, inequities in that pay gap. So when you look at Latina, Indigenous, Black, and transgender women, we see those pay gaps are even worse. And we also see racial and ethnic inequities in median income and unemployment rates. And we know that many people we've talked to and looked at face discrimination in hiring and employment, especially trans and gender diverse job seekers, also immigrants, formerly incarcerated women, and domestic violence survivors. They're getting as much help as they can from really wonderful, dedicated service providers, but still finding challenges in the systems that are supposed to support them. So these quotes speak to some of the challenges that we heard about, particularly this first quote at the top from a domestic violence service provider. There are so many survivors that are just stuck and can't get out because of economic issues. And then this other quote is from an Indigenous woman leader who is trying to help Native women access education and training. There's also this issue of a lot of these job training programs, they have this approach to education that is like not even sometimes 3 strikes and you're out, and it's not helpful. They're not designing these programs in a way that is supportive of family and of women. So as we get ready to look at poverty, we're going to see how all these factors affect poverty rates. We're going to have one more poll question related to employment, which is which factors contributed to the gender pay gap that we saw earlier, and that is reflective of these systemic challenges. Okay, has everybody voted? All right, so the answer is actually all of the above. So I think folks were very much aligned with that in your voting. So in fact, all of these things affect the gender pay gap and affect poverty as well. So the good news is that the overall poverty rates have gone down in the last several years regionally for women and girls. Yet this graph, which I know may not be that big on your screen, does show racial and ethnic inequities. So the brown bar is Asian females, the yellow one is Black, the orange one is Latina, and the gray one is white. So for example, we see in Franklin County that Black and Asian women and girls face the highest poverty rates. In Hampden County, fully 1/3 of Latinas are living in poverty. So we see that lack of affordable, stable housing in particular is a critical issue affecting many women and their families. And this was an issue that rose to the top for the Economic Security Hub. Okay, one more poll question, and then I think we probably are done till almost the end. So which 2 economic conditions do you think improved for women and families after the pandemic? These were all things that got worse during the pandemic, but which 2 of these do you think got better after the pandemic? So you were right. You were right. Yes. So inflation is still a major problem. Access to affordable housing is at crisis levels. It already was before the pandemic, But women went back to work, and so the unemployment rates went down and the labor force participation rates went up. Something that is an important consideration related to poverty and economic opportunity is education. So the last thing I want to talk about before we switch to talking about health and well-being is women's educational attainment. So the good news is that women continue to increase their educational progress through high school and post-secondary education. They continue to outpace men, which is good news for women, but not good news for men. And also we look at female leadership in school districts, in superintendent roles and principal roles, and we're seeing a lot of growth there as well. But there are still challenges, to be sure. And we know that formerly incarcerated women are needing a lot of support to be able to even just get to high school equivalency and then beyond. And I want to just mention quickly the cliff effect. So that occurs when wages from a new job opportunity cause income to go up, but cause public benefits to go down or to go away, so that a woman, a female head of a household, may actually lose net income as a result of getting an increase in wages. And there's actually a pilot project that's going on in Springfield to address that, but it's a big problem that policymakers and advocates are looking to address. So we talk about many different aspects of health and well-being. I wanted to focus on mental health because it is a huge crisis nationally and in the region, and especially for girls. And it's been a focus of the community health needs assessments. We also have a behavioral health roadmap now that focuses specifically on youth mental health, which Leela just dropped in the chat. So this is a lot of bars. I don't expect you to digest it all, but the second and third bars from the down from the top, male and female, shows that girls have consistently reported much higher rates of sustained sadness and anxiety than boys. And then when we look down at those with a disability versus not, and also LGBTQ versus not LGBTQ, we see huge differences in the rates of mental health symptoms. So there's a lot of community energy going toward addressing this crisis, and a lot of good work that we can build on. So some other things related to health and well-being, again, looking at that data we got from those interviews and focus groups, we see a lack of adequate transgender care, especially in rural areas. We've mentioned previously that women are being kind of re-traumatized by systems and bureaucracies, which is affecting their health. Native women and girls don't have access to culturally responsive care in the western part of the state. So there's one Indian Health Service organization in eastern Massachusetts, and there's nothing out here in western Mass. And we know that many immigrants have limited access to linguistically responsive, culturally responsive healthcare. And I also want to briefly mention that maternal health is a major issue in this state. We just got data right before we published this report, and we have not had a chance to see if it's been broken out for Western Mass, but statewide, complications from labor and delivery have actually gone up over the last 10 years, and the gap for Black women and Black birthing people in particular has widened relative to white people. So that's a huge issue that's on our radar and will be a focus of the community health needs assessments going forward. So I'm briefly going to touch on a few other topics in my remaining few minutes, but I do want to leave time for questions and feedback discussion. So reproductive justice is very broad. It doesn't just relate to access to abortion, but also talks about access to comprehensive sex education, prevention and care for sexually transmitted infections, access to parental leave, the right to be in child-free and in safe places to raise children. So we just have a few aspects of reproductive justice that we are focusing on today. There's a lot more in the reports. So this chart looks at prenatal care. Prenatal care is a really important indicator of the health and well-being of the parent-to-be and the child-to-be. Unfortunately, and this is looking at data from 2016 and then 2020, which was during the pandemic, we saw a marked decline in access to, or rather receipt of adequate prenatal care. So we're going to be looking to see post-pandemic if those numbers improve. But there are racial and ethnic inequities that preceded the pandemic. Also, those who have private insurance are more likely to have adequate prenatal care than those who are publicly insured. In terms of access to abortion and reproductive health care, we do have a state that is very committed. The leadership is very committed to protecting access. But we do have crisis pregnancy centers in our state. We have them in our region. They often mislead clients and don't provide medically appropriate care. So that's something that is on the advocacy agenda to address. So now I am going to talk about violence and safety for a few minutes. I know this can be a very upsetting topic. So the COVID pandemic was really hard for domestic violence survivors because of the lockdowns and the lack of access to services. The Jane Doe Inc., which is a network of domestic violence and sexual assault serving organizations, in 2020 reported an 84% increase in requests for services. So this quote on the left really speaks to what is needed for domestic violence survivors to get the support they need. And then we also found that when we looked at safety, that transgender and gender diverse folks don't always feel safe, out in the community, in the workplace, in schools. And so that's really important to be aware of. Another aspect of violence and safety is incarceration and the school to prison pipeline. So the good news is that women are a very small and declining percentage of incarcerated people. That's the bar at the bottom. That's kind of going straight across and going down. So in 2022, only 3% of women, 3% of people who were detained were women. Unfortunately, though, this top bar or top line shows that that the percentage of incarcerated people who are detained is actually much higher percentage women. So 62% of detained and incarcerated people are female. So women are overrepresented, particularly in pre-trial detention. So detention after arrest and before actually being brought to trial. So that's a very disconcerting statistic. All right, we're going to wrap up with a focus on leadership and political participation. And we have one more poll question that relates to this graphic. So this graphic shows the percentage of women who are CEOs of major Massachusetts corporations. So it shows that 8% of CEOs are women. So what proportion of all CEOs are women of color, do you think? So while you're filling that out, I will just say the good news is that since 2019, female CEOs in top corporations actually doubled from 4% to 8%. So even though it's still a very, very small and not at all where it should be, it did double. So we had a couple of votes for, half the votes were for 1% and then split between 2, 4, and 6. So it's actually 4%. In fact, the growth, the doubling of women in corporate leadership from 4 to 8% was entirely because women of color went from 0% to 4%. But obviously they still face glass ceilings, and we can see here from this lower tier number, glass staircases. So women are getting to a certain level, but not getting all the way to the top. And there are a lot of reasons for that. We talked a bit earlier in the earlier poll question about the pay gap. There's a lot of similar issues at play. Racism, sexism, old boys networks, family care responsibilities that still fall primarily on women, gender norms and stereotypes about what leadership is, what it looks like, and women being less likely to advocate for themselves in the workplace. It's also really important to note that transgender and gender diverse residents, that's what TGD stands for, also see a real lack of representation of trans and gender diverse folks in all sectors. And there's very little data that's actually even available on that, but there's not very many folks who are publicly identifying as trans or gender diverse in leadership roles. And finally, political participation. The good news is that female political leadership has grown at the state and local level. So 5/6 of statewide offices are filled by women, but there's still lots more that needs to be done. Similarly, we have 37% of our state legislative delegation from Western Mass are women, and 5 of the 10 mayors in Western Mass are women, but we still see a real dearth of women of color in leadership positions. So the Data Hub, the Women's Fund Data Hub, has even more data, and it has access to the 2 reports. So thank you. And with that, I'm going to turn it back over to Jessica.
Yeah, thank you so much, Lisa. Gosh, that's such a powerful report. And I remember seeing it in person this fall and just being really overwhelmed. Even though you said there were limitations about collecting data, for some folks overall, this report is incredible. So thank you. So questions, there are no questions in the Zoom Q&A, but we did prepare some for you all. So one of the questions we were hoping you might respond to are, what are some examples of actions that people can take to advance gender equity in the region? And I would open that up to Amihan and Lisa, whoever wants to go first. So what are some examples of actions that people can take to advance gender equity in the region?
Well, one of the things that I would say is, to be really focusing, I think, on having organizations taking a really critical look at their infrastructure and systems, and finding ways to really embed diversity, equity, inclusion, belonging, and access within the organization so that they can continue to provide opportunities and open doors for women and gender diverse BIPOC to continue to advance within organizations. So I would say attend some of our equity succession planning series, continue to support the work of organizations that lift up the leadership and voices of women in the community. coming to events like this, where you're having the opportunity to learn about the status of gender equity within the area and the region, so that you can find whatever your unique part to play is in addressing some of these issues. Whether it's talking to legislators or trying to find resources within your own organizations to address particular issues that have been highlighted in the report. So I think it takes a village. It takes all of us doing our own specific pieces, no matter how small or broad they are, that are going to help address some of the issues that have been presented in the study.
Thank you. And Leela and Lisa, any thoughts from you as you were doing talking with people and creating this report? Any specific activities that you want to highlight?
I think for me, it's leaning into what Amihan said about we all have a part to play. So you don't have to be working in an organization that directly does gender equity work, but really living those values every day. And are there pieces of your life that you can lean into? Is there a certain piece of legislation that we've talked about, or a certain area that you feel like your legislator should know about? Like, everyone can email their legislator and encourage them to pass legislation that really aligns with some of this work. And so I think whether it's on a local or a statewide or a national level, we all have a piece of this and can advance gender equity.
Those are both very helpful answers. And I would only add that I know we all receive a lot of newsletters and get on listservs, but I think picking those 2 or 3 where you're going to really be getting that gender perspective on an issue or on what's going on in the region could be helpful, so that you're keeping that lens top of mind. And then also there's a Massachusetts Commission on the Status of Women, and there are local level commissions as well. So those can be places to learn more, to network more, as well as, of course, getting on the Women's Fund newsletter and looking for opportunities to connect with the Women's Fund's advocacy efforts.
Mm-hmm. And with regard to the data, was there any data that was cut as you researched and wrote this report, are there data that you all can remember that we really need to build systems for capturing as we move forward to support the understanding and be able to continue sharing information about gender equity? Any data that comes to mind?
Yeah, I can start.
Yeah.
I think there was plenty of data where we realized that there just are not consistent or enough data sources that are actually collecting data in a way that is helpful. So, for example, related to gender, oftentimes data that's collected does not accurately convey or capture the complexity of gender. And so many data sources, for example, are still only using female and male, which is not representative of who lives in our communities. And so I think that's one example. And then I think maybe Lisa could speak to the intersection of identity or other pieces of it.
Yes, thank you. There are some data sources that may allow you to sort the data by racial ethnic categories or by male, female, binary categories, but don't let you do both at the same time. And we found that particularly with educational data. So that's one example of the shortcomings where people hold multiple identities and we can't always actually look at the data at that level and cross those identities to understand those nuances.
And just one last question. I know, Leela, you said that when you all were giving the presentations this fall, there was a consistent question, which I think specifically relates to advancing, work through policy, but why are women overrepresented among people held pre-trial in that data set?
Yeah, it's a really good question. It came up for us as I was pulling some of this data. I was really confused by that as well. And I think really some of the research coming out of Wellesley was around the fact that folks who are held pretrial often just can't post bail, cannot pay the money to get out and be outside and not held in incarceration while they're waiting for a trial. And so oftentimes that amount is less than $500. And so when we think about inequities in how much folks are getting paid, inequities in employment, it's not a surprise that then women are held because they're poor, and it is a concern across the board. But we do see an overrepresentation of women among folks who are held pretrial simply because they cannot afford to pay their bail, and that's a really concerning statistic.
Well, thank you so much for calling that out. That feels like a direct potential activity that we could take in our region to really lift up, you know, policy change around that, and of course, economic equity. So I want to thank you. We are at time, and Amihan, thank you so much. I know all those wonderful programs that the Women's Fund offers is on your website, like you shared, and we really do encourage people to check those out and get involved. And I really just want to thank all of you for taking the time to be here and hear the data, and please check out the report when you have time. So thank you, and please fill out our short survey. We look forward to seeing your feedback, and really appreciate you spending the hour with us. Thank you.
Thanks, everyone.